We're heavily focused in population health area, the accountable care organization, which is really honed into a lot of analytics work, kind of congregating the data as well as mining the data, and hooking across the community with health information exchanges. But what we're finding is in Texas, in some cases, the organizations we want to have hooked into an HIE aren't necessarily as compelled to do so. So we're trying to look at new ways to get the value proposition up with, let's say, a private HIE that meets some of their other needs so that they'll wish to hook in and be able to let that data flow. But we're propping up like an HMO, and that type of work is definitely new operations for us. At the same time, with all the new initiatives going on, we have the basic day-to-day work that we're doing all the time, and that work requires a lot of care and feeding. While we've recently received a Davies Award and we're a HIMSS Level 7 organization, when you take a look at it, there's a lot of refresh that has to happen along the way, as well as ways to get efficient. We're dialing a lot of cost out of our system. We have to do everything faster, better, cheaper. So between the dialing back of the costs and the expansion of these new initiatives, it keeps our plate rather full. For our organization, with these new initiatives that are going on, we're propping up call centers, HMOs. We have new physician offices that are linking in. We're hosting a number of organizations on our electronic medical record, but we're going to be hooking folks into our HIE as well. With all those different initiatives going on, at the end of 2014, I think the foundational components will be in place, but it's one thing to have the tools and it's another to be using them effectively. So when you're taking a look at the change that is going to take place in the organization, there is an expectation in 2015 as well as the years to come. There's all the refinements, because we know what we know, but we don't know what we don't know. And in the scheme of things, our organization is going to have a lot of work ahead of it. You work with a high-performing team, for one. That helps, because then you share the stress as you're putting it. But what I mean by that is it's complex within the walls of our organization, but those walls are starting to fade away, and you're having bring your own device. So now it fades away to what someone brings in, a device that's a personal device to them and a preference of their own. It fades away in that we're plugging in with community physicians as far as these HIEs. Home health, we're working in the home health realm. And as you start to take a look at the various monitoring devices and getting all of that to speak to each other, or even pushing out data into an untethered PHR, all of that requires managing EPHI. And from our standpoint, helping to educate the folks that are using those tools, as well as create the safeguards for the organization so we can maintain a high degree of privacy and security, that's a very difficult balance, because when you have your walls around your organization, you have your fortress, very easy to protect it. When those walls fade away, it is much more difficult to be able to protect your organization, and that's going to create challenges for years to come. But we're up for the challenge. We have a lot of thought leadership in our organization, as well as we look at consultants that have mastered certain disciplines, and we're able to enlist them to be able to help us to the cause.